All right, Dr. Rafich here from Vet Triage. We are starting a brand new JAVMA, July 1st, 2015, and we are going to be talking about what is your diagnosis. Here we go. So this is a canine case report. The study comes out of the Veterinary School in Virginia, Maryland. This is a, 13-year-old female spayed fox terrier that presented for vomiting, decreased appetite, and enlarging abdomen. What you're seeing here is transverse computed tomography or CT scan, CAT scan, and then the dorsal image, and we'll go over what all these are pointing to. The dog also had lethargy, generalized muscle atrophy, slightly pale mucous membranes, distended and turgid abdomen, a complete blood count found regenerative anemia, and thrombocytosis. So anemia, we think usually four broad categories: decreased production, increased destruction, sequestration, and loss. And so you want to think of that. And then the anemia is regenerative, meaning that the bone marrow is responding to the loss of red blood cells. Thrombocytosis could be for only a few reasons, really. You're looking at cancer. There's some endocrine diseases, inflammatory can cause it. That's a bit tougher one, but anyway, thrombocytosis. And then mild azotemia. Azotemia, think of pre-renal, renal, and post-renal causes. On the serum biochemistry, also hyperphosphatemia, hypoalbuminemia, elevated alanine aminotransferase, elevated alkaline phosphatase, gamma glutamyl transferase, hypochloremia, hyponatremia, hyperkalemia, and then the coagulation panel with prothrombin time and partial thromboplastin time are normal. Abdominal synthesis found serosanguinous effusion without infectious or foreign material. So all these electrolyte abnormalities, you want to think about whether or not is the body losing them through some method, like for example through the urine. Is it losing them through the GI tract? Is it a problem not necessarily with losing them necessarily, but decreased absorption? Is there a problem with increased intake? There's decreased production. So you have to think about the hemodynamics of the electrolytes and how they normally concentrated in the body. And then albumin, where there's low albumin, you're thinking decreased production, like an acute phase reaction, or increased loss, like through GI or kidney. So each one of these, and this is for veterinarians who are a bit newer, each one of these abnormalities on the blood work, you need to start thinking about what could be the possible cause as to their origin, not diagnoses, but the actual pathogenesis of why a chloride would be high or low, right? And so you have to think about these things, and then you'll find commonality in these theoretically, and that will help you down the road of further diagnostics to collect, or maybe now you have an answer, or you can at least categorize your differential diagnoses in an order depending on those results. Okay, let's go to the CT scan. So the black arrows here are showing peritoneal effusion. So here and here, this gray area, here's more peritoneal effusion, very obvious. And then the small intestines are surrounded by a soft tissue capsule, white arrows. So here's this thin white capsule there. All the intestines are bunched together. And thin capsule, all the intestines are bunched together. And then there is a partially mineralized mass. That's this, where the asterisk is. So you can see mineralization here. Here's the mass as well. Mineralization up here. And so all these findings indicate compartmentalization and encapsulated appearance of the small intestines is indicative of sclerosing encapsulating peritonitis. So diagnostic imaging findings and interpretation. There's a 10 by 10 centimeter peripherally enhancing and centrally hypoattenuating mass from the right side of the liver extending to the level of the fourth lumbar vertebra. An irregular area of mineralization in the cranioventral aspect of the mass is apparent. The small intestinal tract appears confined within the soft tissue capsule and located on the left side of the abdomen. Both kidneys displaced dorsally, moderate amount of peritoneal effusion. Differentials include neoplasia, abscess, hematoma, granuloma. But overall, they're thinking that whatever this mass is, there's also sclerosing encapsulating peritonitis. Treatment and outcome. The dog was taken to surgery for an exploratory ciliotomy. The thick fibrous capsule was found overlying the entirety of the abdominal contents, with the exception of the urinary bladder. So if some portion of the urinary bladder is considered retroperitoneal, that may be why the urinary bladder was not included in the capsule here. The mass was found on the right side of the abdominal cavity and was also encased in thick fibrous tissue covering. The stalk of the mass was ligated, the mass removed, came back as hepatocellular carcinoma with multiple areas of hemorrhage and necrosis. Evaluation of the adhesions with histopathology revealed granulation tissue, fibrinous peritonitis, chronic hemorrhage, all consistent with the diagnosis of sclerosing encapsulating peritonitis. Prednisone and tamoxifen was started after the owners visited the oncologist with their dog. Comments. Sclerosing encapsulating peritonitis is a rare disease of dogs with severe inflammation resulting in the encasement of abdominal organs within thick layers of collagenous connective tissue. I had one case of this that I wanted to actually publish. I don't remember why I didn't publish it. I think I just didn't have a lot of support, I think, in the publication, and maybe we're missing data points. I don't remember why I couldn't publish it, but it would have been nice if they had the surgery images here because it's such a rare condition. I've seen one in 20 years. Such a rare condition that I wish they had surgery images here to help educate the readers. In humans with sclerosing encapsulating peritonitis, the most common computed tomography findings include mineralization of the peritoneal membrane, thickening of the peritoneal membrane, intestinal wall thickening, and intestinal tethering, loculation of peritoneal effusion, and intestinal dilation. Underlying diseases including steatitis, fibroblastic ingestion, bacterial peritonitis, leishmaniasis, and mesothelioma have been diagnosed in dogs with this condition. In humans, this disease has been associated with the administration of beta-adrenergic receptor antagonists like beta blockers, peritoneal dialysis, peritoneal venous shunts, blunt abdominal trauma, asbestos, carcinoid syndrome, and recurrent polyscleritis, also known as familial Mediterranean fever. The underlying cause of peritoneal effusion associated with sclerosing encapsulating peritonitis is likely multifactorial, including vasculitis, immature collagen in vessels, lymphatic obstruction, portal hypertension, concurrent biliary disease, mixed inflammatory cells, erythrophagia, which is indicating chronic hemorrhage, reactive mesothelial cells, and fibroblasts can be found. Corticosteroids are used to slow the progression of disease by way of decreasing fibrous tissue formation and blunting of the inflammatory response. Tamoxifen is a nonsteroidal anti-estrogen drug used in conjunction with surgery to control a case of this disease in a German Shepherd dog. This medication promotes degradation of collagen through production of transforming growth factor beta and synthesis of metalloproteinase. Surgery to remove the compartmentalized adhesions, open the fluid pockets, and remove necrotic organs is indicated in people. Surgery to remove adhesions in dogs is unsuccessful, leading to multiple intestinal perforations and subsequent euthanasia. So, other causes of this condition, and again, this study was in 2015, so there could have been more papers since then. Repeated abdominal surgery can cause this in dogs as well, and anything that causes inflammation in the abdomen can cause it, but I've had a case of this, and I also had a case in a pug that I suspected was probably early onset of this. The other treatment they didn't mention here is diuretics. They didn't mention that prednisone also does create a diuresis. The idea here is to dry out the abdomen, but also diuretics like spironolactone especially is used for this condition as well. I don't know why they didn't mention it here, but anyway, it's a cool study because cool case report because it's rare and fairly straightforward once you diagnose it, and you won't forget it. It's very unique in its presentation and its findings, but there are some missing information in this case report as well. So anyway, thanks guys. We'll see you again tomorrow. Bye-bye.